We're on the brink of getting to the place where obesity will replace smoking as the #1 health risk, not only in our state but in our country. And we cannot sustain the cost. But I'm tired of seeing people in my state live unhealthy lives and die early deaths that could have completely been avoided had we had policies in place that encouraged them of what to do and then gave them the tools to do it and created the kind of incentives that would actually reward them for doing what was better for them. We are in epidemic mode. 10% of Arkansas's population is using 60% of the insurance money. $3 billion a year is money spent on 600,000 people who are currently on Medicaid in Arkansas. Healthy Arkansas is a focus on putting all the resources of this administration and of state government into creating a healthier state. The launching of Healthy Arkansas is really about creating an entire momentum for a culture of health that no state has ever attempted before. Elimination of tobacco use, exercise, and normal body weight. If we get those three things under control for an individual, it means an additional 13 years of life.
The essence of Healthy Arkansas is that we don't want the government to come in and prescribe behaviors, but rather to reward behavior that is positive and healthy. We're going to order state agencies to ban smoking in an area within 25 feet of the entrance to all state buildings effective July 1st of this year. The second thing we're going to do is to ask each state agency to study banning smoking on all of the property that is under the control of that agency, reporting back to us by December 31st of this year.
The tobacco settlement funds were the genesis of it, no doubt about that. I'm still very proud that Arkansas is the only state that has continued from day one and to this day use all of its tobacco settlement funds to improve the health of its citizens. We're making headway, and that's the good news. The effects of diabetes are dramatic, and they have enormous economic impact on all of our citizens, but also on our entire state's budget. We think that this program is really a model. We hope that it is as infectious and epidemic as is diabetes in America. People who get regular education and information and an ability to learn how to control their diet, get tips on exercise, get monitoring, all of those things, that they begin to improve.
That was me just over a year and 105 pounds ago. Now, if I can lose weight, anyone can. I'm Governor Mike Huckabee, and I have a challenge for all Arkansans. Let's take control of our health and our health care costs. Did you know that if we maintain a normal body weight, exercise 3 times a week, and don't use tobacco, that we're likely to live 13 years longer? Let us help you get started. Call this toll-free number for more information or log on to our website. Let's work together for a better state of health.
It was a law that was passed by our legislature that I signed, and what it does, it measures the body mass index, which is really more important than a mere weight, because it indicates the markers and propensity toward being overweight or obese, which therefore kind of gives some indication of whether you're headed towards serious health risk. This is mailed privately, confidentially, and discreetly to parents, not to the child. The child never is given this information.
In Arkansas, Governor Mike Huckabee is on a mission. He worked off 100 pounds after a doctor's warning. Now he's considering financial incentives for state employees who eat right.
I don't want the government being the grease police, but what we have to do is to create an atmosphere in which healthier choices of life are rewarded.
We are the only state in the country now where the chief executive of the state has said we're going to do something about these issues, and as a result, the people of Arkansas are going to be much healthier.
And the Walking Trails is really all about helping some families make some important decisions. Decisions about their own health and fitness, and quite frankly, decisions about how to bring them together as a family. We launched an initiative in Arkansas called Healthy Arkansas. It's a building program in which we're trying to change the paradigm of health care from pouring more money into paying people when they get sick to encouraging people to get well. It's uncharted waters, but as we're charting them, we sure do like what we see. And I think you're going to see an expansion of it not only in Arkansas, but I hope it literally does become, as I say, an epidemic across the country. We have spent a generation or more in public policy saying we've got to put more dollars into providing care for sick people. Why on God's earth have we not figured out that it would be a lot better for not only the budget of the state and the federal government, but it would be a heck of a lot better for our citizens if, rather than making our primary mission that of providing more care for sick people, that we did a little bit more on the promotion side of prevention and wellness so that we could promote healthy citizenship. That makes more sense.